My name is Adjani Peralta, and I'm a postdoctoral research fellow in the Department of Environmental Health at Harvard T.H. Chan School of Public Health. I'm also a member of the International Society of Environmental Epidemiology. I'll be presenting our paper on low-level PM2.5 exposure, cardiovascular and non-accidental mortality, and related health disparities in 12 U.S. states. Recently, the EPA revised the annual PM2.5 standard from 12 to 9 micrograms per meter cubed. Only a few studies have investigated whether the new standard for lower annual PM2.5 concentration is sufficient to protect the U.S. population as mandated by the Clean Air Act. Our study utilized generalized linear models to examine the association between annual PM2.5 levels and 5 mortality outcomes across 12 U.S. states at the census tract level from 2000 to 2016. We aggregated predicted annual PM2.5 exposures from a validated ensemble exposure model, ambient temperature data from DayMet predictions, and mortality rates for all census tract years within these states. Additionally, we conducted 2 sub-analyses to determine whether positive associations persisted at exposure levels below the current PM2.5 annual standard and for individuals under the age of 65. We also assessed effect measure modification by race and education for the association between PM2.5 and all CVD mortality by stratifying by race and education to identify susceptible subpopulations. A major advantage of our study is the inclusion of all deaths in 12 U.S. states, ensuring representation of rural and urban areas as well as individuals under and over the age of 65. For our main results, we found that for each 1 unit increase in annual PM2.5, we found positive associations with all 5 mortality outcomes. We continue to see positive associations in our 2 sub-analyses as well. To investigate whether combinations of race and education modify the association, we presented stratified effects of a % increase in these mortality rates for each 1 unit increase in annual PM2.5, cross-tabulated by race and education. Our findings reveal that the differences in PM2.5 related mortality was greater when comparing Black populations to non-Black populations than when comparing populations with low versus high education levels. Although higher education appears to offer some protection against PM2.5 exposure for all-cause mortality, the increased risk remained higher for highly educated Black individuals compared to their highly educated non-Black counterparts. Thus, beyond higher exposure levels for vulnerable populations, our study also found increased susceptibility among Black individuals, irrespective of education level. While the EPA and state guidelines have expressed intentions to reduce racial disparities in U.S. environmental policies, our study highlights that Black populations continue to face higher risk of PM2.5 related CVD mortality compared to non-Black populations. We hope you enjoy our paper. If you have any questions, please send an email.